March is Colorectal Cancer Awareness Month, and we have two doctors here to explain the importance of this deadly disease, Dr. Kevin Cronley and Dr. Terry O'Toole. Thanks for being with us.
Thanks, Julie.
Thanks for having us.
Talk to us about how important it is to spread awareness of colorectal cancer.
Well, Julie, colon cancer is the third most common cancer in the United States and third most common cause of cancer-related death. And in fact, about 49,000 Americans will die of colon cancer in just this year. The good news is that colon cancer is almost 100% preventable with appropriate awareness and screening. And we've seen dramatic improvements in the mortality rate of colon cancer over the past 10 years. And so part of the problem, though, is still about a third of Americans aren't getting screened. And in the Tri-State region, we're even worse than that. Only about 63% of Tri-State residents are getting appropriate colon cancer screening. So that's why we're here today to raise awareness about this deadly condition.
That's not a great rate. 63% of you out there are being screened. That's it. So for the other 37%, what age range are you talking? Who needs to be screened?
Correct. So we usually start screening around age 50, and the reason we do that is because looking at studies, we know colon cancer starts peeking its head out around that age. There are certainly people at higher risk that we would start screening people earlier, but for the most part, around age 50 is when you should start talking about this with your physician. The great news is that there's more awareness out there amongst physicians, so physicians should be bringing this up to you, but if they're not and you're over the age of 50 and haven't had a colonoscopy or screening for colon cancer, you should definitely bring it up. Now, is this targeting men more than women or women more than men, or is it equal? So men are slightly at higher risk for colon cancer than women, but both are at a high risk and both should be screened around the age of 50. There are certain individuals at higher risk. Certainly family history plays a huge role. So if you have a family member, for instance, that has colon cancer, mom, dad, brothers or sisters, you're double the risk of having colon cancer in your lifetime. And if more than one, you're almost 4 times the risk of an average population patient. So it's significant.
And I'd imagine a lot of people who haven't been screened are probably terrified just upon hearing the word colonoscopy. Talk to me about the process. Is it as scary as it sounds?
Well, so the best way to prevent colon cancer is to undergo a colonoscopy. And there's a lot of myths and rumors about colonoscopies. And what a colonoscopy involves is drinking a bowel preparation the night before, which is a liquid laxative preparation, so that we can clean out the linings of the intestines and properly inspect them for cancer and precancerous growths called polyps. Then the day of the procedure, at Ohio GI we use a form of IV sedation so that patients are comfortable and don't have any pain during the procedure, to inspect the colon and remove any of these potential precancerous growths before they turn into something bad like a colon cancer. Patients typically only have to take 1 day off of work and are able to return to work the next day after the procedure.
And Kevin, Terry, if people want to get in contact with you guys or want to learn more or research more, tell me how they can reach you and check out your website.
Sure. So we have a website, ohiogi.com. It's a great resource. It has a lot of information on colon cancer. It also has our office locations. We're throughout the Tri-State. We see people from all Indiana, Kentucky, Ohio, so we're happy to see any patients who have issues or questions about colon cancer.
Sounds good. Thanks for being here, and thanks for helping spread awareness. Get out there, get screened, save your own life.